Hi, I'm Dr. Marc Demers, board-certified surgeon, surgical oncologist, and NAMS certified menopause practitioner. In this video, what I'd like to answer is the question, what is visceral fat? When I was a kid and we would see middle-aged people, men generally, who had thin arms, thin legs, and very little fat elsewhere, but had a rotund, round belly. We used to call that a beer gut or a beer belly. And when I was a kid, the assumption I had was that the abdomen had grown to accommodate the volumes of beer that those men may have drunk. And that's incorrect. That look, though, is common. And when people have large amounts of fat deep within their abdomen, creating a round belly where the fat is not under the skin, but deep within the body, that is visceral fat. And it is to be distinguished from subcutaneous fat, which occurs immediately beneath the skin and can happen all over the body, whether it's your abdomen, your chest, your arms, legs, buttocks, and so forth. Visceral fat is talked about separately because it is different from subcutaneous fat, and specifically, it is more dangerous. It turns out that visceral fat, the kind of fat deep within the abdomen, is associated with the production of lots of chemicals. Some of them are toxins that lead to inflammation. Some of them are hormones, which can lead to type 2 diabetes. It can lead to increases in death from early heart attack and stroke. They can lead to cognitive decline as we age, and they can lead to Alzheimer's disease. So when we speak about obesity and when we speak about fat, we will increasingly talk about not all fat, but specifically visceral fat. By definition, visceral fat is fat that occurs among our visceral organs, which are the liver, pancreas, spleen, stomach, and intestines. For reasons that are not entirely clear, it is the fat that exists there that is the most dangerous deposition of fat in our bodies.